I have a knee therapy special edition for you today. We'll strengthen and stretch the muscles around the knee. So basically the legs. Just make sure you do whatever you can. You don't push into any pain. Let's go. Okay, welcome to knee therapy. So usually the most common issue for knee problems is weakness around the knee. So below, above the knee, front, back, there's just imbalance of muscular structure. And our aim in therapy would be to strengthen, but also stretch those muscles, because only then the joint is able to move and act smoothly, right? So we're going to start with a exercise I love for quads and hip flexors. We're going to do 10 reps. Bring your hands to your hips for easier movement, and you're going to lift from the core the leg. Lock the knee, straighten, point the foot or flex the foot, but do something with the foot. If this is too easy for you, you can bring your arms out, but you cannot compromise through the back. You've got to stay straight up. So keep the chest up. With the exhale, really pull the belly in. Your core muscles and your hip flexors are also always connected. So it's 2 and 1. If you are weak in those muscles, I'm not going to make you do a second set on the same side. So we're going to switch. 1. Make sure you're not using momentum. 2. You use muscle string. 3. If you feel it on the upper thigh, that's perfect. 5. 6. Exhale on the way up. Don't go faster than this. This is already quite fast. All right. To the outside. This might be very hard for you. A lot of people are very weak in the adductors. So just try your best. If it's not as high, that's fine. Again, you could intensify, because you have to hold way more in this area if you bring your arms out, right? Let's just do one more. Okay, other side. Stabilize. Start. Again, same rule. Don't use momentum. Don't move too quick. Don't compromise through the back. It's 4, 5, 6, 7, 8, 9, 10. Okay, very nice. Next is a warrior training lunge alternation. So we're going to start with the right leg in front. Sit low as you can. We're going to strengthen the quads, the glutes, and the hamstrings, tibialis anterior. And if you lift your heel now, we're going into the calf, which is very important for the knee. A lot of people get Baker's cyst with chronic inflammation in the knee, around the knee. So strengthen all the structures around the joint will help. Let's just stay here. Breathe. We're going to do 1 minute holds on all these. Lock the left knee, the back leg. You can bring your arms up or to the side. It doesn't really matter. You can even, if this is really hard for you, keep your hands on your thigh. This is about the legs, so whatever you need to do to make it happen. If you need a break, you can come down with the knee and then come up again to finish up the minute. All right. And then we go down. And this is kind of like a stretchy sister. Now, you bring the knee out and you come onto the outside of the right foot sole. So the knee is pointing a little bit out, and that's going to vary with your hip flexibility. If that's too intense, you can just keep it forward. But I'm trying to give you some IT stretch at the same time. Mainly though, we want to focus on the stretch here, on the hip flexor, on the quad on the left side. Just try and really relax the areas you've just been working on. And we'll stay 15 more seconds. Relax your neck. All right, let's come up. We'll do the other side. I'm just going to turn on the mat. So lock the right leg in, for me at least, the back leg. Sit down as much as possible. Right glute tight, and maybe you want to go up with the heel, okay? This would be adding into your calf strength. Important. Again, you can have this option, or arms up, whatever you like to do. Just make sure you can breathe calm and you really keep the attention in your quads, your thighs, and your glutes. Breathe calm. 20 more seconds. You can do. The heel lift can make it quite intense. Bring the heel down if it's too much. 3, 2, 1, and we lower down. Good. So again, I'm going to turn the sole up off the floor. So don't bend into your ankle, but stretch into your hip, right? And then try to relax the right hip front. Chest forward. This might be very intense for you. Just see what's possible in the range of your natural breathing. Incredibly effective for your leg strength. When done in the right dose, lunges are by itself quite a therapy for all kinds of leg issues. All right. So next is Horsestance. Very good for your adductors, right? Like I already told you, a lot of people are very weak in the adductor range. Make sure your ankles are somewhat around below the knee. Not too far in, not too far out, okay? And then you sit. If you need your arms like this, you can have them. If you can, forward or out to the side would be even more preferable. Try to really activate the glutes, pull the pelvic floor up, and just breathe a little more. We're holding also this one for 1 minute. But I got a candy coming up for you. Just one more strength posture after this. We're doing the nice alternation, so no worries. If you want to, for the last 10 seconds, lift the heels, lift the chest. Good. Okay. And we lower into a squat. Keep it wide. If your knees hurt, you can always bring your hands more forward and try and slowly ease into the squat. Or you can even squat against a wall behind you. I thought it was closer. So you can just find your ways to do this. If it's not okay at all for the knee, for the back of the knee, you can also bring a fist between your calf and your thigh. That takes a little bit of pressure out. Whatever you need to do, but try and find a resting pose. And just breathe. Eventually, you'll be able to do this nice and easy. Heels on the floor. You can bring a block under your heels even if you need to. And then eventually, like this, feet together. But don't think about result at this point. We're trying to heal you from knee pain. Okay, so we're going onto the floor and we're going to do one leg bridge. So you lay down on your back, you bring your feet quite close, but not touching, and bring your arms next to your body, okay? Your knees and feet are hip width apart, and we start by lifting the hips. Stay like this. If this is already hard for you, then you should just stay here, okay? If not, straighten the right leg. This time we're not bringing the knees together because I'm thinking more of your hamstrings than your inner thighs. We already did inner thighs. So making sure the back side of your legs getting strong. The right leg is very locked, very straight, super strong. And the left foot is pushing all the way into the floor. So don't sink down too much. Just keep on lifting the hips, locking the knee. It'll be okay. Don't worry, you can do this. Right. And then slowly bring your foot back in. And very gently roll your spine down back to the floor. I will stay here for a moment. And we're just going to do one more side. And then we get a nice yin stretch. Actually, 3 nice yin stretches, since if you do this daily, you don't need to do 1,000 things. You just need consistency, mental awareness, and a calm breath, and a little bit of faith. Okay, good, let's go. We do another one. Lift the hips up. Again, if this is already enough for you, you are allowed to stay here. But if you did lift one leg, you should do the other two. So just make sure you're pushing really into the floor. If one leg is too intense for you and you're staying at a both feet bridge, you can lift your toes off the floor and push the heels into the ground. That's also going to accelerate a little bit more hamstring muscles. Keep the chest up, keep the hips up, breathe. Don't give up. Relax your shoulders, relax your arms. This is so good for you. You'll see. Five. Okay, foot back in. Hips up one more time. Roll down your spine. All right. There we go. We stay just a moment still in bridge rest. Wonderful alternation for a strength posture is just keep in a relaxed manner, still some blood flow compression. And then you straighten your legs. Okay, so we're going from here into a wonderful 3-minute stretch pigeon. Now, a lot of people have a lot of trouble with Pigeon when the knees are hurting. And so we're going to try and figure out what's the way you can do it. Okay? So the normal Pigeon would be like this. So your knee is really folding, basically very close to your pelvis. The heel is touching the inside of the pelvic bone. And you can just relax forward or even down. I'll show you in a minute. If this is too much for your knee, you can bring your foot away from your hip. So then you're increasing this angle. It's going to make it more intense on the hip, but your knee should be feeling better, okay? Flex the foot and just use your hand to gently push against the knee, and you're just going to lean over to this side. Kind of sternum to foot. All right? And then there's a third variation. If this is all too much, then you can always just be basically on your leg. For some people, this is better, and it's still going to give you some of the stretch. I am looking for stretching your IT band and your tibialis anterior. So generally, it would be better if you would have a little bit of angle and rather a wide angle like I showed in the second variation. Then no angle, but if you are starting in this journey, it's okay. And you're going to bring your left shoulder down now. So you're twisting away from your leg, if you can, if it's somewhat in your capability. I'm going to stay just a little bit longer, just in case you had to figure out where you are in Pigeon. You'll do this every day. You'll see exactly where your body can go. And trust me, I had a lot of trouble with this pose in the beginning, and many years. It's been a ride, up and down. But if you learn to relax into this stretch, this is really beneficial one. Especially you do strengthening with the legs. You just need to understand that you need to bring your body weight of the upper body away from the knee. That is the most important thing I can tell you about this stretch here. So 3 minutes would be over now, but we're going to stay just a little bit longer, maybe 30 more seconds, making sure that you had 3 minutes in the stretch and not around the stretch. Try to really feel IT band, outer hip, the tibia, the muscles around it. All right, that's it. I will turn on the mat, just so I'm not turning away from you when I talk. Left leg long. It's also, by the way, it's normal to have 2 different sides. So sometimes this will be considerably harder on one leg. Often we have one knee that is worse than the others. So I also have to figure out always on the right side where I'm at. Every day is a little bit different. Like I told you, get your weight off your knee, so away from it. That's going to make it so much easier to deal with this stretch. Because there shouldn't be any load in your knee, really. It's not about that. It's about stretching your leg muscles. And it shouldn't be twisting your joint, and it shouldn't be pushing into your joint. And just one more time, try to relax into the position if the knee hurts. Keep the foot flexed. Maybe even push a little bit against it so you get some help. If you can, you want to lay your right shoulder down and really relax onto the ground away from the knee. We always deal with the same problems when we are in chronic pain. The most important part, I keep telling you over and over, if you are aware of my classes, is to accept the pain. There's no point in fighting it. If you fight the pain, it's not going away or anywhere. It's going to yell at you louder. You need to accept that this is happening and that most likely you have been doing this to yourself. Whichever way. I'm not saying you're guilty. I'm saying it didn't happen with no impact. So then, when we start accepting the responsibility, the other part is listening. Less result-based. More checking in. Where am I today? Oh, interesting. Today I can do this. Oh, interesting. Today I can't do this. And then accept it. That's another part of the first step to deal with chronic pain. All right. Good. 3 minutes over. So, we're going on to the back. We're going to spine twist. This is a very nice stretch on your IT band. I'm going to give you 2 variations because it depends on your flexibility, okay? Since we just did the right leg, why don't we just do the left now? So one option is to just cross left leg over and go to the side. Or you can eager cross. So bringing the foot around too and cross to the side. And you can just lay here and stay. The other option is if you feel you can do this with your legs, to go to the other side with the left leg up. That way, you'll have a little bit more intense stretch into the side of your hip and your sacrum. Either side you pick, but pick one. And we'll stay another minute. Lengthen the spine away from the hips and just relax your right shoulder even more, or your left shoulder, depending on which side you are, the one that comes off the floor. And the second step I keep over and over repeating is, if you want to get rid of chronic pain, you need to learn to ask yourself, how can I move without putting pressure on the part that hurts? Not moving is not the solution in almost all the cases. Even after surgery, you're asked to move right after surgery. For good reasons. We know that it increases the blood flow and promotes healing. Other side. So whatever leg, just do the other one. I did the second variation, other side, depending on how you want to see it. So I did the one where I'm crossing over to the unusual side. So I am crossing now with the right leg on top to the right. If you were to do a normal easy twist, you would now go with the right leg on top to the left side. Relax here, lower spine. Relax your IT. Relax your shoulders. If you learn how to listen to yourself and how to move around your injury or your source of pain, but not giving up on movement just because of that, your whole body will support you in healing that particular part as well. And eventually you'll be doing all the things again that at the moment you cannot do. It's a matter of time, patience, tolerance. All right. So we're getting out of this. The last one is a wall split. Now, I don't have a wall, but you should have a wall. So you go to your next wall. I'm just going to lay here as if this were my wall. You're going to put your bum against the wall, and then you're going to bring your legs up like this, and lay down and wiggle your butt close. And if it's too intense, you can wiggle a little bit away from the wall. And then you're going to bring your legs out against the wall like this. And I'm just going to hold my big toes now. But you shouldn't do that. Or maybe I'm just going to hold my legs. You don't have to do anything. You just lay down on the floor. I have no wall. So I'm creating something like a wall. If you don't have a wall either, just like me now, then you can do this. I'm holding either you can hold your adductors or your calves. You shouldn't, grab on your knees, just on a muscle belly part. And just relax into it. I'm relaxing my shoulders, I'm relaxing everything, relaxing the sacrum. So we were working on your inner thigh strings. Now we're stretching it. Of these easy stretches, we've already been stretching everything we've been strengthening in the beginning. Usually, what's really important too for all kind of knee pain is a quad stretch. And we've been incorporating that into the sister posture of the lunge. Just stretching the hip flexor and the quad by trying to relax into the hip. Because usually when you have a knee pain, the very common quad stretches are, too painful for most of the people. So I chose to keep it an easy one. And whenever you progress and you want to add an extra quad stretch, you can either do recline hero, just folding the knees, heels out, but touching the hips and then leaning back. Or you can do that at the wall. You can comment down below and then I will send you some stretches. Or I make another video. All right. You can lay here as long as you like. If you want to come out, you just bring your both legs to one side and you roll out of it. And that's it. Make sure you move easy after stretching. It can be quite intense. If you do this more often, you will love the wall split. It's going to be so good for your legs and your mind. Turn on some nice music, enjoy, and I'll get going. I wish you a good recovery. See you next time.